So moving on to our last but very much not least presentation, I think this is actually going to bring together a lot of the things that we've already spoken about and bring the gender element to the fore, which is very welcome, is Pip Henty and Maya Tamayo, who are presenting on tracking the progress and impact of women's leadership in COVID-19 responses in the Philippines. Pip is a leader at the Humanitarian Advisory Group, or HAG, and specializes in gender and inclusion in humanitarian practice. Over the past 8 years, Pip has worked in operational and technical roles and has worked across the Asia-Pacific regions. Pip currently leads HAG's research into diverse and inclusive humanitarian leadership and is working with UN Women to measure women's leadership in COVID-19 responses in the Asia-Pacific. Maya Tamayo is the co-founder and program manager of Angat Bayi, which translates as Uplift Women, a groundbreaking program in the Philippines aimed at promoting women's entry into politics and developing them into feminist leaders. She is an awardee of the Connections Through Culture, Arts and Creative Economy Research Grant by the British Council in the UK and East Asia, and was selected as part of the first cohort of the Women Together for a Better Normal program by Ashoka and the Standard & Poor Global Foundation in 2020. Recently, she was chosen as one of the fellows of Vital Voices VV Engage Political Leadership Fellowship Program. Thank you so much for joining us today, and I'll hand over to you.
Wonderful. Thank you so much. And it's so lovely to be presenting today. Good morning, good afternoon, good evening to wherever you are in the world. My name is Pip Henty, and I'm a leader with Humanitarian Advisory Group, and we recently worked with UN Women to develop a framework and pilot this framework that tracks the progress and impact of women's leadership in COVID-19 responses. So over recent decades, there has been an increased focus on women's leadership in humanitarian and development contexts. Evidence highlights the important role of women's leadership in bringing invaluable contextual knowledge, skills, resources, and experiences to emergency preparedness, response, and resilience building. And this has been amplified in the context of the COVID-19 pandemic, with key humanitarian and development actors recognising the importance of women's leadership in responding to the impacts of the health emergency and in supporting locally led responses. So this project is part of, or contributes to UN Women's broader project in Asia Pacific, Women and Girls at the Centre of COVID-19 Prevention. Sorry, having some technical issues, bear with me. So the purpose of this research, as I mentioned, was to develop the framework and tools to measure women's leadership and participation in COVID-19 responses in Asia Pacific. And we then piloted the framework and tools in the Philippines. So we really wanted to develop tools that could be adapted to different crises, so beyond COVID-19, but also different contexts such as country, sector, or organisation. And what we measured was 4 key areas. So the women's leadership and participation in COVID-19 response framework includes 3 result domain areas: safe and meaningful participation, collective influencing and advocacy, and partnership capacity and funding. And each domain has a result indicator and a set of progress indicators. There was also, as you can see here, the overarching impact domain, transformative leadership. And the indicators and means of verification were drawn from a consultative process with key actors, in addition to building on existing approaches to measuring both localization and women's leadership. So what did we do? So we piloted the research in the Philippines, and we used a mixed methods approach. So we conducted 24 key informant interviews, sent out a self-assessment survey with 61 responses and reviewed 52 documents. And there was engagement with women's rights organisations, national and international NGOs, UN agencies, local and national civil society organisations, and national and local government. We had national consultants, so Maya, who'll be talking shortly, lead the data collection and contributed to the design, debrief and analysis process as well. Over to you, Maya.
Thank you, Pip. Good afternoon, good morning, good evening, wherever you are. I'd like to start with the safe and meaningful participation domain that Pip mentioned earlier. This domain seeks to measure the extent to which there is safe and meaningful participation for women and its impact on broader COVID-19 response efforts here in the Philippines. There is moderate evidence that women and women's rights organizations participate actively and safely in decision-making process and can influence outcomes. Diverse women and national and local women's rights organizations are engaging with the COVID-19 response mostly at the local government level, while women's organizations participate mostly in CSO fora and community meetings, but not in national level decision-making and coordination fora. While there were low levels of women's participation and representation at the humanitarian coordination, these platforms were seen as critical fora for increased women's rights organization representation over time, particularly the GBV and subcluster and protection cluster. Although the national GBV subcluster was only reactivated in December 2020 last year, UNFPA as the co-lead has supported the Department of Social Welfare and Development in GBV preparedness and response activities prior to this. The lack of participation at the national level resulted in unmet needs for women. For example, women's multiple burdens increased during the pandemic with little rest from unpaid care work. Sexual and reproductive health also became harder to access. An increase in GBV cases was observed. I guess it's global. The necessity of these services had not been adequately considered in the response planning here in the Philippines. There was also moderate evidence that coordination and consultation fora address access and safety consideration for women's rights organizations. These organizations have been able to participate in a wide range of fora during the pandemic through online platforms mostly. However, this also creates additional barriers to diverse women's participation. For example, women with disabilities might be unable to participate if sign language is unavailable, or rural women may have difficulty participating if there is no or poor internet connection. There were also instances when some women's organizations are not simply invited to the meetings. It was also noted in the study that the more mainstream and less gender-focused fora women participated in, and the more senior these meetings became, like at the national level, the less safe they felt. This was due at first power dynamics that can exist between international and national organizations. In the reflections of WROs, it showed that international organizations had a majority of power. The second was the perception that the culture in some of these fora led to their derogatory remarks being directed at left. For collective influencing and advocacy, the second domain, this domain measures the extent which women's rights organizations are supported to advocate and engage with processes that influence COVID-19 responses. The evidence that COVID-19 responses are holistically influenced by the priorities of women's rights organizations has been assessed as moderate, because while there have been successful examples of advocacy influencing, there seem to be ad hoc rather than sustained and systematic. There is moderate evidence that the national and local women's organizations and grassroots networks are able to advocate for and engage in the development of policies and standards in relation to COVID-19. 85% of women rights organizations surveyed stated that it was through active advocacy which they influenced decision-making during the pandemic. In some local government units, women's rights organizations can advocate because leadership, and these are mostly women mayors who have the gender lens, provides the space for their issues to be integrated in the pandemic response. Meanwhile, international partners and donors have amplified the voices of national organizations and women's rights organizations. For example, some women's rights organizations who are in the front lines were not allowed to provide service, so international partners advocated for them to receive humanitarian passes to allow greater movement to implement their programs. However, despite the active advocacy and some examples of influence, impact on national and policies and standards has been limited. Only 21% of the women's rights organizations surveyed and none of the international actors believe that the national and local COVID-19 policies and standards reflect the priorities of women's rights organizations. This gap between the wealth of work and advocacy happening at the grassroots level and the ability to meaningfully influence policies and standards is reflected in the poor opinion of the extent to which gender is addressed in COVID-19 response here in the country. Back to you, Pip.
Thanks, Maya. So for women's rights organisations to shape COVID-19 responses, they must be supported to prioritise their organisational needs, to strengthen their capacity to deliver programs and to access adequate funding, as well as have decision-making input within those funding opportunities. So the research found that there was good to strong evidence of equitable and complementary partnerships between local and national women's rights organisations and other responding actors during COVID-19. So where project partnership existed prior to COVID-19, WROs reported increased flexibility and more equal partnership dynamics. There were also examples of COVID-19 response proposals being co-created, designed and implemented, with 73% of women's rights organisations interviewed noting that this was the case. However, these positive examples were not across the board and were not reflected in all partnerships. Women's rights organisations and some international humanitarian organisations noted that program design was often where unequal power dynamics emerged, and in some cases, women's rights organisations reported no to minimal input to project design. There was also good evidence that donors and partners helped to build the capacity of WROs to effectively and efficiently respond to COVID-19. A diverse range of stakeholders reflected that conversations between WROs and their partners occurred quickly after the pandemic hit, and that this early responsiveness helped facilitate appropriate capacity support. And conversations covered from the operational barriers and opportunities COVID-19 posed, how to overcome or leverage them, what resources were needed, and what form of engagement was needed with government agencies. And although the overall picture in relation to capacity support was positive, again, some WROs felt that they had not received a lot of support from their partners beyond the financial support. To technical support, leadership support were all areas in which organisations felt their partners could provide additional input. But also important to note that these were challenges that were faced pre-pandemic and were only exacerbated during. There was also good evidence that WROs have sufficient financial support that enables them to respond effectively and efficiently. Notably, for 72% of WROs surveyed, funding increased or stayed the same, and most interviewees accessed additional funding or were able to reallocate available funding for COVID-19 response activities. However, while many WROs reported that the COVID-19 pandemic did not reduce their overall funding, again, where some of the unequal power dynamics came out was that they would have liked greater engagement in control over funding decision-making and greater flexibility with some of the conditions attached to that funding. So bringing it all together. So there is emerging evidence that WROs are able to contribute to leadership and decision-making in COVID-19 responses, definitely at the community and their local government unit level. They have played a strong role in the operational response to COVID-19 in the Philippines, leading activity implementation and service provision in the community and the grassroots level. Yet the significant involvement of WROs and women in local and operational context was not reflected in representation at national and strategic forums, as Maya highlighted previously. So as the report unpacks, support is not consistently provided to WROs to engage in, influence and contribute to decision-making and leadership at the national level. Consequently, WRO's leadership in the COVID-19 response remains very localised and community-based. So again, what does this mean? So as I mentioned, there's distinct and encouraging evidence that WROs are participating safely, collectively influencing and experiencing equitable partnerships in the COVID-19 response. However, this is not consistent and not at the national levels. So WROs had relatively little impact on the overall direction of the response, as Maya highlighted in the perception of whether or not COVID-19 response plans and activities prioritised women and their needs in the activities. Over to you, Maya.
Thank you, Pip. This is our last slide, but this is one of the most important slides in the presentation, and this will be very short. Even though this is just a snapshot of the women's rights organization's experience and not a comprehensive assessment, we hope that this research can be an impetus to create change. We hope that this baseline can act as a catalyst for change among humanitarian actors, including the government, national, international NGOs, UN agencies, etc. Second, we also hope that this should prompt organizations and coordination fora to set targets and track change to better include, support, and elevate the role of women's rights organizations in COVID-19 and broader humanitarian responses through providing spaces for collective decision-making in goal setting and implementation, funding and technical support, and ensuring participation of women's rights organizations in every step of the way of the project cycle or any pandemic response. Thank you very much, and we are very looking forward to a robust discussion after this. Thank you.